Today in a series of Docplexus KOL interviews, we have with us Dr. Gaurav Luthra, an international renowned eye surgeon. At present, he is a director of the Drishti Eye Institute and specializes in advanced cataract and laser refractive eye surgery. He has won numerous awards like the prestigious IIRSI-JOS Gold Medal by the Jaipur Ophthalmological Society in 2016, Subodh Agarwal Gold Medal at IIRSI Annual Conference 2013 for his exemplary work in cataract and refractive surgery. He was a past president in Intraocular Implant and Refractive Society of India, and now he's a chairman of academics and research for IIRSI and the secretary of Uttarakhand Ophthalmology Society. Thank you, doctor, for this interview. So your first question is, what are the recent surgical advances for effective management of cataract patients in India?
So there has been a lot of advancement in cataract surgery over the last 10-15 years, and we've seen a huge difference in cataract surgery evolving from being just a cataract surgery where we would remove the cataract or the white lens and replace it with an artificial lens. We were not so much worried in the past about whether patient could see well with or without spectacles. So what used to happen was that after cataract surgery, even though we were putting a lens into the eye, patients would still end up needing significant power of glasses. So they would not see well. They could have powers of something running into 5 or 6 diopters, and they would not have quality vision without glasses. So what has totally changed in the last few years is that now cataract surgery has become more like a cataract refractive surgery. So the aim of cataract surgery is not just to remove the cataract and put in a lens, also to ensure that people have good quality vision without glasses, and to the extent that now we can actually use special lenses which can correct astigmatism like the toric lenses, and we also have lenses which give you ability to look for near, distance as well as intermediate. So as you've noticed that people's needs have grown over the years, and now they look at they want to do near work, they want to see the phone, they want to see the iPad, they want to see the laptop, and they want to see in the distance. So our needs have grown and we need all ranges of vision. So with new cataract surgery, we have the possibility of giving people quality vision without glasses for near, intermediate, distance. So people are practically free of glasses for almost all all the activities that they need to do. And many people who have worn glasses through their life, like thick glasses, at the time of cataract surgery, they are now practically free of glasses, and it totally changes their life. So that's been a big revolution, I think. Another area where we've progressed significantly is with laser cataract surgery and image guided cataract surgery, which has come in, and I think we'll talk about that later on.
So moving to our next question, are there any serious side effects associated with refractive surgery of complex cases?
So refractive surgery has been, laser refractive surgery, when I want to say refractive surgery, has been around for more than 25 years now. It's a long time, and as we are aware, about 7 or 8 million people have undergone some kind of laser refractive surgery in the world. So it's one of the most commonly performed surgeries, elective surgeries on any part of the human body. So that's the big numbers that we are able to do. So there is, it is time tested, proven and safe. It's got safety margins which are thought to be amongst the safest of all surgeries that we do on the human body. Yet it is only safe when you follow all the protocols and when you make sure that your case selection is good, you are meticulous with your patient examinations, investigations, understanding the patient's needs, and also being not in a hurry to operate. So the dictum is, when you see a patient first time, don't offer a surgery right away. We'd like to see our patients over a year or two, make sure that they are of the right age, their tests meet all the criteria of a safe refractive surgery. As well, you said complex cases. So yes, now we do operate on a lot of complex cases as well. The good thing is that over the years, we now have with the option of offering several kinds of procedures. So from the time that we started with something known as PRK or surface laser treatments. And even before that, we were doing something known as radial keratotomy, which is no longer in vogue. But current laser techniques, there are at least 3 or 4 different techniques which are available to us, and they apply to different group of patients. And we have option to do phakic lenses as well for those patients who are not able to go for a laser refractive surgery. We can treat right up till -25.
So doctor, what is the impact of advances in surgical diagnostic and intraoperative guidance systems on refractive surgery outcomes?
So, intraoperative guidance systems are now used for both cataract and refractive surgery. They have again made a huge change to the way we operate our patients, and good that you got this question. And so there is something known as, we have now topography guided LASIK, where we are able to use the cornea's shape is taken out by a machine known as a topographer, or we can measure the aberrations in the eye using something known as an aberrometer. And then we can customize the treatments using intraoperative guidance systems. So there is something known as iris recognition. Typically what used to happen is that when we were doing our laser treatments, we would not be sure whether those lasers were perfectly firing. They were very good, but to take it beyond what a person can do normally, we have these image guidance systems during laser refractive surgery which can lock onto the person's iris and make sure that the laser is delivered at the exact point where it is needed to be delivered. So that takes us to something beyond the normal person's vision, to something known as eagle vision or 6x5 or 6x4 outcomes. Similarly, in cataract surgery, we have image guidance systems now, something like the Callisto or the Virion, which we use. I use the Virion system. Now, what these systems do is that they take an image of the eye much before the surgery, and that is transferred onto the microscope of the surgeon. So when you are operating the patient, when you are looking through the microscope, you can see the eye of the patient with an overlay. So these are guidance systems which almost work like Star Wars. You have everything kind of highlighted inside the view of the surgeon, and he knows exactly how to operate, which area to make your incisions, how to place the lens perfectly. So they have made us much closer to perfection than we were ever there, which is what translates into these phenomenal results where patients can read the last line on the chart following surgery without any glasses.
So moving on to our next question, can you please tell us what is new in refractive surgery?
Okay, so these are very exciting times for refractive surgeons like me. I've been doing refractive surgery for a good 15-20 years now, and as I told you, laser refractive surgery has been around for more than 25 years. So laser surgery has evolved a lot. When we talk about laser surgery, most people think about LASIK as the way that laser surgery is done. But believe me, there are about 5 or 6 ways that we can use the laser machines of different kinds. So what has caught our fancy for the refractive surgeons of late is something known as SMILE, or small incision lenticule extraction. Now this SMILE technology has been around for about 4 or 5 years, but it got US FDA approval only about a year back. I've been doing it for about a year. So how SMILE has really changed the way that we do refractive surgery is that as compared to LASIK, we can do SMILE without lifting up a flap of tissue from the cornea. So typically, we've done LASIK for a long number of years. LASIK has excellent results for the patient, very safe. Yet, in the back of the surgeon's mind was always this fear that we are leaving behind a flap of tissue, which even though it sticks perfectly to the eye, if you were to have an injury down the line, even 10 years later, this flap can move just like a contact lens. So if you had a strong injury, so it would happen maybe 1 in 10,000 patients, and then some other flap complications which are possible, but it's a nightmare for the refractive surgeon to get a call from a patient maybe years after the surgery that, doc, I got hit in the eye and my flap has moved, because then it requires surgical management and stuff. Now what SMILE does is that using the femtosecond laser, we can create, instead of creating a flap of tissue, we create a cap of tissue. So we make a small 2 mm incision, and using the laser now we can use a very thin, like just about a 50 or 60 micron thin layer of tissue from inside the cornea without actually invading the cornea. So it translates into so much of safety, and it also leaves behind a much stronger cornea when you're not shaving off about 1/3 the thickness of the corneal tissue and leaving behind a fully intact cornea with just a sliver of tissue removed. You're leaving behind a much safer cornea. The recovery is much faster. Patients can go back to work within a day or two, and long-term risks and complications are phenomenally less than what with LASIK. So as I said, SMILE has really transformed. Although only a small group of patients is still eligible for SMILE, and it is expanding. We will soon be able to do it for people with plus numbers, with high astigmatism. So it's growing, and I think the future is with SMILE.
So doctor, based on your experience, would you like to share any challenging case that you've come across?
A lot, so I do a lot of challenging cataract surgery and a lot of challenging refractive surgery. I have special interest in pediatric cataract surgery. So I do a lot of, and pediatric cataract surgery even by itself is much more challenging than it is for adults. So I do a lot of pediatric cataract where, which are complicated cases with lens colobomas. Recently I had to operate upon a young child who had a bilateral lens coloboma, which basically means that the natural lens of the eye was malformed. So only half of the lens had formed and half of it was missing. So the child had very bad vision, could not even read the biggest letter on the chart, was not able to do well in school. So we did both eyes surgery with a gap of say about 3 weeks, and we use special techniques where these lens colobomas require special management with special devices. Luckily now we have access to a lot of new innovative devices which can help us. So we use something known as a capsular tension segment, which is a special device which allows us to form the bag of the lens in a better way and fixate it so that we can implant a lens. This was thought impossible a few years back, and now we can do it, and this child did extremely well. He's about a 9 or 10-year-old child, is now able to read 5 lines on the chart without glasses, very thankful, and I was very happy to see that this child could benefit. Like that, we have a lot of other complex cases that I handle, including a lot of refractive surgery, laser refractive surgery, and I think very satisfying job for the doctor to help these patients. Yes.
So doctor, lastly, I would like to ask you, how can doctors use platform like Docplexus for sharing their views to the community?
I've been following Docplexus for some time, and I get regular mails, and I've seen your app, and I think, it's really nice because you come across these really nice thoughts and queries and questions which doctors throw up and their thoughts. So it reaches out to a huge number of people. And I think Docplexus is doing a great job because of percolating useful information to a lot of people. So typically what happens is that everybody does not reach out to conferences. Everybody doesn't get, resources like journals and everything freely accessible to them. But almost everybody sees their phone. Everybody looks at their email. So how Docplexus is reaching out is that 90% of those doctors who don't typically attend conferences and meetings and other educational resources, it's reaching out to them in the way that they like, and it's very catchy because you can kind of just click on something that pops up on your screen, and you can visit the app and you can have the views of thousands of doctors who are commenting on a particular thing. I think it's great. Yeah.
All right. Thank you so much, doctor. It was a pleasure having you here.
Thank you.